Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. We have today case scenario discussion about a case with a prolonged labor. Okay, please read the scenario of this case. A 33-year-old woman has a history of prolonged labor for more than 24 hours, resulted in one living boy infant 3 kilograms. She appears anxious, has a dry mouth, and a pulse rate of 120 beats per minute. She is able to pass only 20 milli of urine, which is dark in color. She hasn't passed any urine for the previous 6 hours. She has no previous medical disorder. Okay? Again, she is 33-year-old woman, delivered vaginal after prolonged labor more than 24 hours, resulted in living boy infant, 3 kilogram, average weight infant. The patient appears anxious, has a dry mouth, and pulse rate of 120 beats per minute. She is able to pass only 20 milli of urine, which is dark in color. She hasn't passed any urine for the previous 6 hours. She has no previous medical disorder. Okay? Okay. So, what is the probable diagnosis? As you see, this patient has a prolonged labor and signs of and symptoms of dehydration. She has a dry mouth. She has a tachycardia. She's anxious. Okay? So, this is a case of maternal exhaustion. Maternal exhaustion due to prolonged labor. Why does this happen? Because of inadequate fluid and nutrition intake during labor. That's why we advise any woman in labor, so long as she is a low risk, there is no risk factors, and she is suitable for vaginal delivery, everything is fine, she should take oral fluids, sugary fluids. Okay? So, maternal exhaustion here is the diagnosis due to prolonged labor. At the same moment, she didn't take an adequate fluid and the nutrition. Okay? And this diagnosis confirmed by the presence of tachycardia, dry mouth, and oliguria. If you remember, she passed only 20 milli urine, and in the previous 6 hours, there is no urine. She didn't pass any urine. So there is oliguria. This is another sign of maternal exhaustion due to dehydration. Okay? So, tachycardia, dry mouth, oliguria, all of these are symptoms and signs of maternal exhaustion and dehydration. Okay? So, what other findings would help confirm this diagnosis? Yes, I can do test for urine for ketone bodies, ketonuria could be positive. As you know, during labor, there is need for much energy. This energy coming from where? From glucose source or carbohydrate source. But if there is lack of or inadequate nutrition and the oral fluids, okay, the body accommodate by taking this energy from the fat stores as in liver, resulting in ketonuria. So if I did a test for urine for ketone bodies or ketone or ketonuria, it will be positive +1, +2, +3, and so on. Also, there may be, if you measure the temperature, you may find pyrexia. Pyrexia can happen in a case of maternal exclusion due to prolonged labor, due to dehydration. Also, it can happen with other causes like pyelonephritis with pregnancy or chorioamnionitis, but here there is no other symptoms and signs suggesting pyelonephritis or chorioamnionitis. So, just ketonuria and pyrexia or fever, or mild fever, may happen in such condition with maternal exclusion and dehydration. Okay, how could maternal exclusion be avoided? How to avoid such condition? You should encourage any patient in labor, so long as she is a low risk and everything is fine and she is going to pass the delivery vaginally, encourage her to take oral fluids, especially sugary fluid, okay? Because she needs this fluid and she needs the sugar for the process of labor because it needs much energy, okay? So advise her to take oral fluid during labor and even during the active phase of the first stage. So continue during the first stage, latent phase, and also in the active phase, so long as everything is fine and the progressive labor is fine and it will be a vaginal delivery and the patient is a low risk, okay, no other risk factors, so go on, encourage her for taking oral fluids, okay. What else? If, as in this case, prolonged labor happen, the patient should receive also intravenous fluids as a prophylactic to prevent maternal exposure. So, in a case with a prolonged labor, this is an abnormal circumstance. Okay, so not only oral fluids, but also intravenous fluids should be given. So the last question, what is the treatment of maternal exclusion? In this case, what is the treatment of maternal exclusion? Patient should be given 2 liters of ringer lactate with 5% dextrose intravenous. Okay? But be careful to give the first liter quickly, but the second liter over 2 hours. So again, you should give the patient 2 liters of ringer lactate with 5% dextrose intravenous. But the first liter must be given quickly and the second liter over 2 hours. If the patient is still complaining of pain, adequate analgesia should be given. Okay, this is very important also. So, this is the treatment of maternal exclusion, and this is the last slide. I hope this case scenario discussion was helpful for you. This is my sites on Amazon and on YouTube and on Blogspot, and this is my box published on Amazon, textbook of obstetric, textbook gynecology, contraception handbook, multiple choice question book, medical disorder in pregnancy, and the gynecologic oncology book. You can find them on Amazon, either Kindle edition or hard copy edition. Thank you, everybody. Wishing you all the best.